Ready.
Let's do it. Hey
Yeah.
guys, welcome to Hope It Helps. And my guest on the show today is Dr. Amal Ismail. Welcome to the show.
Hi, thank you for having me.
Thank you for your time. I really appreciate it. So, Amal, I found out about you quite recently through a friend of mine that you've been working with, Yasmin. So, shout out to Yasmin. I'm sure she's going to be listening to this at some point. Uh,
Yeah.
and it was really interesting listening to the work that you guys have been doing together and learning about what functional medicine is. That's something that I haven't been aware of in the past. So I thought it'd be super interesting to talk to you to get to understand a bit more about yourself, your background, what functional medicine actually is. And, because I think bringing awareness to things like this could potentially help some people in ways that they previously weren't aware of. So that's what I'd like to start with today. But before we get into all that, why don't you give everyone just a little bit background about yourself, where you grew up, and we'll take it from there.
Great. Thank you so much. It's such a privilege to be on your podcast. And Yasmin is such a wonderful friend and a patient. So definitely a shout out for her
For sure.
for this introduction. It is really a passion of mine and a mission to spread functional medicine across the globe. And it's lovely to be here to talk about it. So originally I'm Palestinian. I grew up in Jordan and left when I was 18 to go study pharmacy. So I completed my pharmacy degree at Nottingham University. Then I practiced in the hospital setting. After which I decided to I had a big passion for research. And so I went to Cambridge to do a degree in bioscience enterprise, which basically focuses on how do you take innovation from the lab to the market? How do you commercialize it? How do you make it accessible to patients? And that was a really fascinating degree. I met a lot of wonderful people. And as part of that, I traveled to New York, lived there for a while, worked at one of the pharmaceutical companies, like putting into practice what I had learned. And following that, I had quite a varied career before I ended up into functional medicine. I worked in a startup actually in Jordan that was aimed at promoting cancer research and in specifically looking at how do you optimize medications from a genetic standpoint for the population in the MENA region, which was great. But then the financial crisis happened. There was no more funding. And I did a bit of work with my dad before I moved back to London. And this is where I joined the consulting industry. And I worked with the pharmaceutical industry on strategy. And specifically, we worked on actually applying what I learned both from pharmacy and bioscience enterprise is how do we take all the information that we know about the drugs, about the disease, and how do we communicate it in the most effective way for all our stakeholders, and how do we make those drugs accessible through governments and so that was a really fascinating work. We designed also a lot of educational material. But throughout this process, I had a really wonderful career, but it wasn't fulfilling because I felt that while I was interviewing patients and working with a lot of patients, especially in the chronic disease area, I realized that there's something missing. And that thing that's missing is the fact that in the conventional setting, what we're doing all the time is we're trying to name the disease, blame it, and then tame it, right? We're not really looking holistically at what's going on with the patient. What's the why? What's driving the inflammation in the first place? Why did this patient develop breast cancer? Why did this patient develop diabetes? There are clues in their life that we just simply ignore. And we look at this sort of backdoor prescription heavy approach to medicine. So it never sat well with me, and I kind of kept exploring different options. I was very fascinated by integrative medicine and Chinese medicine, and I was just always reading about it. And then it's really through my own personal journey, I got very sick, living the lifestyle of consulting, traveling, working really long hours, burning the midnight oil, and I just didn't know what was going on. So I got really unwell, and then I met a functional medicine nutritionist, and it just blew my mind how she assessed my entire life story and gave me clues as to why I am in the state I'm in. And then I went on to sort of this healing journey where I changed my lifestyle, my diet, so on and so forth. But ultimately, while I was still working in consulting, my husband was a big fan of Tony Robbins, and he said, "I think you just need to come with me to one of those, to his UPW event, and maybe that will give you some answers," because I was still really searching. And really that was the turning point. I went to that event. It completely changed my perspective on life. It unearthed a lot of limiting beliefs, and most importantly, that's when I was introduced to functional medicine through Mark Hyman, who is the head of the Institute of Functional Medicine at the Cleveland Clinic, which is the top institute in the world for functional medicine. And that was it. Just clicked. I was like, that's what I want to do. That's where I need to be. And then the rest is history, really. I left my work. I completely dedicated my life to functional medicine. I got certified by the institute, got taught by all the experts in functional medicine. And some of them are still my mentors till now. And yeah, I never looked back. And it's just been such a rewarding experience. So I practice in London. I have a private practice. And pre-COVID, it was a mix of face-to-face and virtual, but as is the case with everyone's, it's now a virtual setup, but it's working. So that's great.
Yeah. Thank you, first of all, for sharing your story. I love the journey, and so funny that you went to a Tony Robbins conference, and that's kind of what brought all the things together. I don't think you're alone. I think a lot of people probably have had similar experiences with that. So I think that's really interesting. So many points to talk about, but I wanted to start just at the beginning. So you seem to, because you've been working in the medical sector for quite some time and in the pharmaceutical industry and so on. Have you always had a passion for medicine growing up? Where does that come from? What was your motivation for entering the medical field to start with?
Yeah, I always loved medicine. My favorite, my favorite game as a kid was to play doctor. I had like all the doctor sets, and I would always be healing my friends or my family, or I just found it fascinating. A lot of my family members are doctors, pharmacists, surgeons. But really, my passion grew from both my parents, because my mom was a pharmacist. She used to work in the United Nations as Pharmacists Without Borders. And I just loved her work. It was so fascinating the way she would talk about medicine and talk about access to medicine in, in those vulnerable communities or in underdeveloped areas or areas where there's crisis. And then my dad, he works in the chemical industry, and he's just phenomenal chemist. And it just, the air in the house was always about biochemistry and science and and service to people. So that's really what where my passion grew. And one of my uncles is a very famous neurosurgeon as well in Germany, and it's just the work he does was fascinating. He would just fix people, bring them back to function. So yeah, that's where my passion was. I always loved it. Always, I was the strongest in biology and chemistry in school. So I think it was always there.
Yeah, it sounds like it was meant to be almost.
It was meant to be, yeah.
Yeah. So, okay, so yeah, growing up in that kind of household, I can imagine. And since you had a fascination for it at such a young age, it kind of was like a natural track, I guess, to enter the medical field in some form or another. But I was
Yeah.
interested that, because a lot of people typically, when they think about the medical industry or entering that kind of field, they look at, being a doctor in traditional medicine and so on. So I'm curious for you, what was the reason you decided to go down the pharmaceutical path rather than going down the traditional medicine path? Was it because of your parents being in those more of the research, I guess, chemical side of things, or what was the reasoning behind that?
It's a very good question. I don't have the answer to that, simply because even when I was at a Date with Destiny event in Tony Robbins, that question, he questions your choices in life, and it was really interesting, because when he questions about, if you close your eyes and remember when you were a 10-year-old or a 5-year-old, what was always your vision, what you wanted to be, and I was like, I always wanted to be a healer, whatever that form would take, I always wanted to be a healer. And at that point, a healer is a doctor, right? That's how we equate it. There's no other healer. But then I think because I guess the influence of my mother, she had a pharmacy as well. I used to spend time there, and I was always fascinated by the fact that you can give a pill and then the person would get better. So I was always interested in the biochemistry side of things. So I think that's why I went into it. And I, when you're 16-year-old, you're quite influenced easily by what, what should you look up to your parents, right? You ask them, what should I do? And I think that's really, there wasn't a very strong desire behind it. I think it just kind of, I went with the flow.
Sure. No, that makes perfect sense. And I guess, like you said at the beginning, what you're passionate about, what you really like, is the research aspect. So I guess entering the pharmaceutical side just makes more sense, because that's where you do the research on drugs and so on. Because a lot of people, when they get into, I've noticed some people get into professions, let's say engineering, law, or medicine, and they study for years and they get the certifications and they do it, and then they enter the industry. Maybe medicine is a little different because I think it requires more dedication than the other ones, but a lot of times people will study those professions and then enter the field, and it wasn't what they expected and they don't like it and they tend to make a shift. So how was your experience when you were actually finally in the field and working, as a pharmacist and then working in the pharmaceutical industry?
So, I really, it's a great question. I really noticed or appreciated the value of a pharmacy degree more recently than I have in the past. I think that with pharmacy, the sad part is in many instances, or in most countries around the world, the pharmacist kind of has a role of a glorified shopkeeper, and really has lost that connection with the patient, and is not really applying his or her extensive knowledge of biochemistry in healing. And I think that for me, I don't regret it. I love pharmacy, because I think pharmacy opens so many doors for you. You can literally choose to work in a hospital and take that path. You can work in a really retail pharmacy. You can work in research. You can work in the industry. You can work in consulting. And then you can take the route that I've taken into functional medicine, or you can even dive into conventional medicine. I mean, it opens so many doors. So I think it's a wonderful foundation to have. But I think that for me, I was always searching for more. So
Okay.
While it was satisfying, it just wasn't fulfilling enough. So that's why I kind of kept going for the next thing and the next thing and the next thing until I landed into functional medicine.
Sure. No, okay, no, that makes perfect sense. I was just thinking because, like you said earlier, it's how you described it, that you could give someone a pill and they could have such a huge effect on their body and like heal them in multiple different ways. So I'm not familiar, so I was curious to see what you would say. So as a doctor, do you have as much of a, I guess, background or knowledge about the actual chemistry of like medicines and so on, or are you more focused typically on treating, I guess, symptoms and diseases from a, I guess, more of a theoretical standpoint? Like I come in, I have, let's say, a chest pain. Okay, what are the symptoms that it could be? 1, 2, 3, and then you apply the medicine to it. So what's the difference between the two?
Right. So in the conventional setting, that is the approach. The approach is a patient comes in, you ask what their symptoms are, you match it to a particular disease, and then you attach the medicine to that disease, because medicines are approved based on their indication for a particular disease. Some are used out of label, and that depends on the skill and knowledge of the practitioner. But in general, that's the name of the game. And really, conventional medicine was first came about because it was about acute medicine. It's you got an infection and you got treated with antibiotics, and then you're fine. But when it comes to chronic conditions, that model doesn't work very well, because chronic conditions are not infections. They're not acute infections. By nature, they're imbalances that have occurred in your body over years due to trauma or choices you've made around nutrition, exercise, your pattern, sleeping pattern, infections in the past, so on and so forth, that have led to inflammation that is now translated into dysfunction, right? Whether it's diabetes or cancer or arthritis. And so when we put on the functional medicine hat on, we look at the body as a whole system. It's an integrated system. We don't look at it as organ specific. We're not interested in how your heart is functioning versus how your kidney. We're actually interested in how your circulatory system is working, how your immune system is working, how your assimilation and digestion is working. So if we look at, it's a systems biology approach to medicine, where
Okay.
we're trying to identify the root cause of disease as opposed to the symptom, and then let's just match a drug to it. So often, more often than not, we're not actually treating with medications per se. We are treating with supplements that are essentially natural ingredients that exist in your body. Sometimes we use herbs, and sometimes we use pharmaceuticals. But essentially what we're trying to do is bring your body back into balance.
Okay. So that's really interesting that, because when I was speaking to Yasmin about it, and she mentioned that you guys walk through, you know, like you said, like you take the whole patient history, kind of like your life and things like past experiences and so on. It just blew my mind that that could still affect you now, because I think that over time, if you have been, I guess, doing the right things, taking care of yourself in the way that you think you should, those problems wouldn't be there anymore. So it's fascinating that it still carries through. And one thing that I've noticed speaking to a couple of different people on the podcast, and a woman I had who's an occupational therapist, and she said something similar to you in the sense that looking at it from in a holistic manner. And
Mm-hmm.
and that's something that seems to be, I could be wrong, but from my perceptions, it seems to be growing, that I guess that ideology of taking a more holistic approach to medicine in general. So why do you think over the last, I guess, maybe like 10, 20 years, because I think in the past maybe it wasn't such a relevant topic, but now there seems to be a lot more awareness about it, and people are starting to realize that you have to start looking at, like you said, as the body as like an integrated system, and there's so many different moving parts that affect one another. So what do you think about that?
Yeah, so I think that the reason we have moved towards that is because the way the system is set up. The system is set up to, treat and move on, treat and move on. The healthcare system is really not designed for prevention. It's not designed for optimizing health. The definition of health in our healthcare system is the absence of disease. But that's not health. That's just baseline, is absence of disease. Health is a state of constant vitality. So what we've been focused on as a result is it's kind of a transactional model to healthcare, right? Whether you're talking about insurance-based system, or you're talking about private out-of-pocket, or you're talking about national insurance, it's all about numbers, right? It's number and volume, and as many patients as you can see, and as many patients as you can treat as fast as you can. So I don't really blame my colleagues in conventional medicine, because they don't actually have the time to spend with their patients, to get to know them, to build that relationship, to understand what led to their illness, because they have 10 minutes. What can you do in a 10-minute consultation? Not much. Although there's wonderful work that Dr. Rangan Chatterjee is doing in the UK, where he's trying to teach general practitioners in that 10-15-minute consultation how they can effectively get to a glimpse of a root cause for a patient, for example, with diabetes, by simply asking, tell me what a typical day in your life looks like. Because a typical day in your life can tell us so much. It could tell us about your eating pattern. It can tell us about your sleep pattern. It could tell us about your stress levels, whether you're lonely or have good social connections, do you hydrate well, and so on. All these habits, all these things that you do on a daily basis are actually biological messages that you're sending to the body.
Okay.
Even the thoughts that you think also translate effectively into biological messages in the body. So it's important. That's why we are where we are now, where people are looking for alternative solutions, because the current model doesn't serve people anymore. We have an epidemic of chronic disease. It is just, wherever you look, there are people with chronic disorders. And it's even in children. I mean, by 2025, the predictions are 8 in 10 children are going to have some form of chronic disease. And
Wow.
that's staggering statistic, and it's really scary. And the reason for that is because of our lifestyle and the environment that we live in. It's highly inflammatory, so much pollution. And so the conventional setting where it's like, we'll wait till you get sick and then we'll treat you, is no longer going to be enough. And it's actually crippling governments, because we can no longer sustain the healthcare expenditure with this a huge increase in chronic disease. So we've got to figure out a better way. We've got to look at prevention, not just treatment.
Yeah. And I think you mentioned such a good point that conventional medicine is more about, you know, like you said, transactional. When you're sick, you come and we take care of you, rather than, like you said, it's about curing, not prevention. And like you said, as if that's the statistic, that 8 in 10 children are going to have that kind of disease in the future, then like you said, 100% something's going to need to change, because medical costs, like you said, are going up all the time, even here, like around the world. Like I know in the States, the cost to do a certain procedure, if you did it there, whether or in a different part of the world, it's like 3 times as much or something. So people also can't even afford to do those kind of things anymore.
Yeah. And I think just to highlight a point around conventional medicine, I mean, conventional medicine is incredible, because without it, we don't have this expanded lifespan that we have, right? People live longer. They're able to cope with diseases in the past that would have killed you right in your 20s or your 30s. So it's incredible. It's amazing in situations of trauma or acute setting. I mean, it is incredible, and we need it, and we've learned so much from it. But it's not as effective when it comes to chronic conditions, right? And that's where we need to look at integrative medicine or functional medicine, and I don't like the labels, to be honest, because it's all medicine. It's just we have to learn how to use the right tool depending on where the patient is on the illness to wellness spectrum.
Yeah, so like you said, sounds like there needs to be an integration or some sort of a balance, depending on whatever the case is or whatever the patient has. Like you said, to use the right tool, I think, is the best way to put it.
Yeah, exactly.
Yeah, and your focus is also, I know you're very focused on the chronic disease aspect, and you're constantly looking for new treatments and so on. So, what's the reason that you started to focus on chronic diseases, and what have you found in your experience so far that you think could be promising for the future?
The reason, I think, for me, chronic disease, I mean, it is the biggest epidemic we're facing. You can see that in countries where chronic disease is rife, like the US or the UK, the implications of COVID have been catastrophic, because your body cannot, if your body is already inflamed because of metabolic dysfunction or autoimmunity, and you get infected with the coronavirus, the repercussions are much more significant, and the progression of the disease and the potential of death is much higher, because you're already what we need to think about when it comes to infection is it's not just dependent on the virus, it's also dependent on the host. So you need to make yourself as much of an inhospitable environment as possible so that virus doesn't thrive, because viruses, bacteria, they crave disease tissue. So if we are healthy and well, our immune system is the best medication there is. And it's so fascinating that we still don't even know how to measure it very accurately. But the immune system is the best tool you have, better than any vaccine, better than any medication. That if it's working well, it can fight off most viruses and bacteria infections. So for me, even in when I was studying pharmacy, the immune system was very fascinating for me. It blew my mind how it's organized, how it is able to differentiate between a major pathogen versus a weaker pathogen. You know, when is it the right time to mount an extreme response? When do we bring down the response? I mean, it's brilliant how it operates. So that's why I find chronic disease so interesting, because it's normally a dysregulation in your immune system that's not working well, coupled with, of course, other imbalances in your system that started in the first place. But also the fact that you have so many young people now with so many unexplained symptoms, not necessarily already diagnosed with a chronic condition. But you know that there's so many people, I'm sure you know, even within your circles, that are, you know, they have brain fog constantly, they're losing their memory, they have stomach cramps, they're constantly bloating, you know, they have, you know, range from constipation to diarrhea, they have low mood, they're irritated, anxiety is on the rise, mental health conditions. I mean, this is not normal. we shouldn't accept it. It's not that, oh, this is our life now, it's stressful, it's normal, we're aging. No, that's not, we age, yes, chronologically, but we don't have to age at the same pace biologically. That really depends on what you do on a daily basis to help you boost your health.
Yeah. I think you made such a good point that, because I've watched a couple of things that talk about the immune system as well and the body's ability to actually repair itself. I can't remember who it was, but they're like, your body has all the chemicals and everything it needs better than any medicine to heal itself if you're, like you said, giving it the right nutrients, taking care of yourself in the right way so that it can fight off potential diseases and so on. But when you coming to the functional medicine part, because I know we touched on it briefly, that you're looking at the system as it's like a biological system and everything is kind of integrated together. So let's say a patient comes in, where do you start? Like, what would, like, let's say I came to you, I have a condition that, or there's something I'm trying to be treated for. Where would you start, and what does that, I guess, methodology or process look like to start, making those changes that I need to make?
Great question. So the first thing I like to do with my patients is open their eyes to all the ailments that they're feeling at the moment. Because most people come to you with with the thing that's most pressing, right? Whether it's, let's say, anxiety or missed periods or constipation or constant bloating, whatever it is, right? It's the first thing that's the thing that bothers them the most. But then there's actually a lot of other signs that the body's been giving you for a while. You've just been ignoring. You're just not attuned to it. So normally what I get my patients to do before they come into a consultation is fill out a couple of health questionnaires. One of them is called the medical symptom questionnaire. And the medical symptom questionnaire was developed by the Institute of Functional Medicine. And the thing about it is it asks you questions about simple symptoms that occur on a regular basis, like headaches, dizziness, insomnia, swollen eyelids, teary eyes, so on and so forth, across the different major systems in your body. And then it gives you a total score. And it's fascinating because when people fill it out, although the major issue was, let's say, the digestive tract, they're lighting up everywhere. And that for me is the first sign to show them, actually, you have inflammation everywhere. Even though this is your main problem, look at all these issues that you've accepted as normal and you're living with it. The second step I do is really go through a deep dive into their health history and life history, because in medicine, in functional medicine, we believe that the story of your life is the story of your health. They run parallel, they're integrated. And it really goes to transgenerational health. I just did a talk for expecting mothers on preconception health, because we now have studies that show that what a mom does during pregnancy, pre-pregnancy and during pregnancy, affects the generation of her family 3 generations on.
Really?
Yeah.
Wow.
Yeah, so it's for me for us when we're doing those consultations, we want to know first of all, we ask about genetic history, like, do you have chronic disease in the family, parents, grandparents, uncles, aunts, siblings, so on. And then the next question we ask is, what was your life in the womb? Right? So did your mom have a healthy pregnancy? Was she stressed? Did she smoke? Where did she live? Did she experience trauma? Did she live during wartime? All of this has a significant impact on the baby's development in utero, and that defines their health in the long term. How were you born? Were you born vaginally? Were you born via C-section? Were you breastfed? Were you bottle fed? All of this has a significant impact on the development of the gut microbiome, on the development of your immune system, on the development of your emotional resilience. So all of this is so important, because that gives me an understanding of what was their baseline to begin with. And then we look at, okay, well, let's now go through literally year by year in your life. What happened? How did you eat? How did you sleep? Did you get any infections? Were you exposed to antibiotics? Did you break anything? Did it heal properly? Were you bullied? Did you have a good relationship at home? Literally, we go through all of that, because that's all signals to me what has been happening throughout your life that gives me an indication of what was the tipping point. Because normally if you ask someone, when was the last time you felt really well? That's the point where things went, when the body was like, I can no longer cope. And that's the tipping point. And
I
then
see.
if you understand that, some people have a very clear tipping point, like a major trauma or an illness or an infection. Some people don't have a tipping point that is a result of one trigger. It's actually multiple triggers that led to the collapse of balance in your system.
Yeah.
So it's
I,
really, we're like detectives. We're looking for clues. That's what
yeah,
we're trying.
yeah, for sure. But I love what you said, that, and I've never heard anyone say that before, that the story of your life is the story of your health. I think that is, now when you think about it, I think that's so true. And it's so interesting how so many different little factors that, or points in your life, whether it's trauma, whether it's stress. And I had no idea that even pre-birth, you could have all these, you could have a baseline set for you that you had no control over to start with. So it's so interesting that you have to go so far back, understand what the whole story was, and then like go from there. When you're working with your patients, because I'm currently taking I'm getting my hypnotherapy certification, and I've
Great.
been learning a lot about the mind and how, and the power of the mind and how much it plays into so many parts of us that we're not even aware of. And when you're working with your patients, is how does the mental aspect come into play? Because from what I've been learning, that it kind of, if anything, all starts from there, your thoughts, your beliefs, how you feel about yourself, and then it kind of translates into physically in the body.
Absolutely, yeah. There's a great book called The Body Keeps Score. It's a fantastic book for anyone who wants to read it. And it talks about the impact of trauma, psychological trauma. And it doesn't have to be, major or minor trauma. And its effect, how it translates physiologically, because there's actually memory that is left in the body. It's like a physiological memory. So even though that you might have resolved the trauma, from a mental aspect, it might have not resolved at a physical level. For us in functional medicine, so we look at the body as 7 systems that are integrated, but at the core, at the heart of this matrix, we call it the functional medicine matrix, at the core of it is the 3 most important pillars: emotional, spiritual, and mental well-being. If those are out of balance, then anything we do around there is not going to work very effectively. The journey to healing would be very, very difficult, because there's so much you can do in terms of biochemical correction in the body, but the mind is extremely powerful, because your thoughts have a significant impact on your cellular biology. It actually affects the cell membrane, and the cell membrane is what the body uses to communicate whatever you're feeling into the cell, into the mitochondria, which is the energy powerhouse of your cell and your body. And so if for example, if you have limiting beliefs or very negative thoughts that you're constantly communicating with yourself, I'm not good enough, I'm not loved, etc., that's signaling messages to your body that produce inflammatory substances that are not helpful or healthy for the body, that really send you into more down the disease path. So for me, that's why when I studied functional medicine, I chose to also do coaching, because incorporating psychology and behavioral change is so important. As well as I'm a huge fan of Tony Robbins, but I'm also part of his leadership training program, because I want to learn from the best on how do you affect change, behavioral change very quickly, and you make it stick, right? Because and I know that, I'm sure while you're learning in hypnotherapy, it's quite difficult. And he's the best in terms of NLP. So I really want to learn how you do that, because people's habits and the way they've been living their life is so entrenched. And sometimes it's really difficult when you dig down there, when you dig deep and you uncover those roots. It's uncomfortable. For people, it's uncomfortable. They've buried a lot of that and they're not ready to cope, to deal with it. But that often is this thing that is the block that prevents them from optimally healing their body. So there's no healing without mental, spiritual, emotional healing.
No, I totally agree. And funny you mentioned that book, because I'm actually reading it at the moment. It's
Yeah.
for, I guess, for a person with a non-medical background, it is a tough read. It's quite very technical. It's quite dense, but I try to take, I guess, the snippets and remember what
Yeah.
they're talking about. But like you said, that book is so interesting, that especially when it was talking about things like PTSD and
Mm-hmm.
how people actually like people who have PSD, how does their, you know, how does their brain work? What do they feel? Why do they still have those emotional reactions? And like you said, I think it's super interesting that you can mentally get over something or process something, let's say, but there's like a little, I guess a scar would be the best way to put it, in your body that
Exactly.
you haven't healed yet. So let's use that example. Let's say we've dealt with it mentally. What do we have to start doing to address the I guess the scar in the body? Because I would assume if you've mentally gotten over it, then that would naturally translate into the physical.
Yeah, absolutely. So one of the ways we look at your how, let's say, how your uh, how do we assess your emotional well-being based on trauma or experiences, is we look at the hypothalamus pituitary adrenal axis. So we look at the HPA axis. And the HPA axis is essentially, think of it as the master conductor of the symphony of your life, right? It decides, you know, who plays when, what hormones released when, what neurotransmitter is released when, you know, what optimally, when should the kidney, this, that in the body function. So we want to assess how effective the HPA axis is, because the HPA axis is what registers messages from the outside world. So when you get stressed, it hits the hypothalamus, activates the pituitary, and then hits the adrenals. The adrenals are responsible for releasing cortisol and DHEA. Now, cortisol is, you know, gets a little bit of a bad rep always, but it's a very important hormone in the body, because it's the one that is released first thing in the morning when light hits your eyes. And it's your get up and go. It's what gives you the energy and the drive to function throughout the day. But then as the day passes, it needs to drop all the way to build sort of your sleep drive. And then towards the evening, that needs to shift so that melatonin is produced. So yeah, so the way we measure your emotional resilience and your capacity to deal with everyday stressors and major stresses in your life is by measuring your HPA axis capacity. And we do that by looking at your cortisol pattern throughout the day, because the pattern gives us an indication of how well you're coping. And so normally you release cortisol as soon as you wake up, and then it slowly declines at the end of the day. And then at night, there's no longer any cortisol, melatonin takes its place, and then that's how you go into deep sleep and detoxification and rest and stuff. The way we test it is through a 6-point salivary test. So you just collect saliva over 6 points throughout the day. And that pattern is a very good indication of what's going on in your life. So if you have a normal pattern, then it means you're quite emotionally resilient, i.e. whatever comes your way, you're able to cope with it. You're able to switch between sympathetic and parasympathetic mode quite effectively. So it kind of gives you an indication of the how well your autonomic nervous system is. If your cortisol pattern, for example, is flat and up or flat and down, below or the limits, or up higher than the limit, then we know that there's adrenal dysfunction, that your body is no longer able to cope with the daily stressors. And it's people, for example, you ask them, you know, are you able to multitask? Are you able to do more than thing at once? Do you get overwhelmed if, you know, you can't get something done, or if many requests come your way? If people are answering, no, I can't, I can only focus on one thing at a time, we know there's a degree of adrenal fatigue going on in the body. Okay. And it really has a lot of repercussions, because cortisol can lead to hypothyroidism. It can also deplete your sex hormones and result in imbalances in your sex hormones. Very dangerous. Well, not dangerous, but it's, you know, it's a major issue for females and fertility and just hormonal health, also in males. At the same time, it can impact your gut, because it causes your gut lining to become more leaky. So that results in toxins that are in the gut, normally don't cross the barrier. They cause inflammation of the immune system. It also shuts down your immune system, and so makes it less effective. So really, it gets a bad rep simply because if it's chronically elevated or chronically produced for a very long time, we have a problem. And so that's what we're trying to assess when we want to quantify that emotional or sort of mental overload. That's what we're trying to do, is we're quantifying it. Another very simple tool, if you don't want to do the salivary cortisol test, is a heart rate variability.
Okay.
And heart rate variability is that is the variation between beat to beat in milliseconds. So you know, when it's different from the heart rate. Heart rate, you get a number, but that number you get is actually an average of what your heartbeat was over that past minute, because your heart doesn't just beat the same thing monotone continuously. That variation is the signals us of how well you can switch between rest and digest and fight or flight response. The lower your heart rate variability, the more you are living in that fight or flight response. You're unable to cope, and that creates disease. And the higher your heart rate variability, the more you are resilient. So it's a measure of resilience, because you spend more of your time the rest, digest, and restoration. And there's loads of things, loads of apps out there now, and gadgets. So the Aura Ring is a great one. There's the heart rate variability monitor from HeartMath that you can buy and use with an app, so that you can practice how to develop coherence and bring your body back into balance. Of course, hypnotherapy, acupuncture, there's loads of things that you can do. But I think that it's such an overlooked area. Stress is such an overlooked area in medicine. And it's gaining, of course, a lot of more traction now, because even in COVID, now we know that one of the markers of good or bad prognosis is how high is your cortisol to begin with. So if your cortisol levels are elevated and you get infected with the coronavirus, then the aggressiveness of the disease in your body is worse with a high cortisol level.
Okay. So interesting. All these things are so interesting. I just don't like how many factors that play into like just us as people and how we work between mindset, the things you talked about, like being able to measure your emotional resilience. I never even knew that was possible, that you could actually quantify how someone would respond like emotionally to a certain thing. When it comes to what I like from what I've understood today about functional medicine, it's a combination of, in a way, and correct me if I'm wrong, please, of therapy with medicine, because getting the life, like you said, getting the life story gives you what the potential symptoms could be, or like, where is this actually coming from? What are the thoughts behind this? And then after doing that, you provide a, I guess, treatment plan to fix those imbalances, or to fix what's like all the things that follow with it. But you start with the therapy part, or the mental part, and then it translates into the physical. And one book that I read, and I loved it, and this is something that I try to do more of, but I think everyone is not the best at it, which is sleep. So how much does sleep play into all of that? Because from what I've learned, at least, sleep is probably one of the best cures that we could have, like, for our bodies, making sure we get enough sleep to process in that way.
Yeah, absolutely. I mean, sleep is critical. Really, it's critical for life and survival. When we think about longevity and improving your health span, not your lifespan, your health span, it's all about sleep. It takes center stage, because sleep is when you regenerate. And just on the point you mentioned before I dive into sleep, with functional medicine, or let's say integrative medicine, what we're looking at is the interface between biochemistry, physiology, and behavioral change. That's what we're trying to combine all three together, right? Because you can't have one without the other. And lifestyle medicine, as a result, takes a very big role, a very big part. So in my prescriptions, there's always, yes, there's the treatment part where we're correcting biochemistry, but there's the nutrition aspect, which is super important. Then there's the sleep component, there's the hydration element, and then there's the mental, spiritual wellness. So I'll often have breathing techniques, meditation, some creative exercises, spending time in nature. And I put more emphasis on these, and of course exercise, than I do on the supplementation. Like, if you do all of this and you don't supplement, you're still going to get tremendous benefit, because we're trying to rewire the way your body is currently wired. Because most people, the body is wired in a state of compensation, right? It's compensating for an issue that occurred, and then you never moved away from that compensatory mechanism. And unfortunately, that compensatory mechanism is only designed to last for a short time. but when it's employed in the body for a very long time, it causes disease. And that's what happens when we have very low sleep. Now, sleep is so critical because it's when we regenerate, when we clean up our body and we regenerate. So for sleep to occur, you need to have very low levels of, almost zero levels of cortisol, and then a good deep amount of melatonin being released, because melatonin not only helps you to fall asleep, but it also helps you to maintain sleep and go into that deep cycle of sleep.
Okay.
Yeah, so it's really critical. It also has many other effects. One of it is it's really one of the most potent antioxidants for the brain. It actually helps the brain detoxify at night, but most importantly, helps seal any holes that are in the blood-brain barrier that have been caused by inflammation or toxins or so on. So it's super critical. And it also helps the thyroid convert the hormone, the inactive hormone T4 into T3 early hours of the morning, so that it's ready to go in the body and set the metabolic rate for the day. So it's super important. There's lots of other functions for it, but these are the things. So when we drink coffee past 12 in the afternoon, what you end up doing is you end up affecting your sleep drive. You build your sleep drive during the day. And that's because coffee has a similar structure to adenosine, which helps build sleep drive. And it competes with that molecule. And as a result, you don't get that effective sleep build, and you have less melatonin being released. The second element is when we drink alcohol late at night. The problem with alcohol, I mean, it has many effects, but one of the things that is disruptive is that when you drink it, you disrupt the first sleep cycle, where you don't go into deep sleep. And as a result, you don't get to release growth hormone, which is your anti-aging hormone, which is necessary for muscle rebuild and brain function and so on. And so you get that first 70 minutes of your sleep. If it's not effective, then you lose on that powerful effect of the anti-aging hormone, of growth hormone being released. And then throughout your sleep, it's your gallbladder and your liver and your lymphatic system are most active during sleep. So the gallbladder is effective between 11 and 1, and the liver is most active between 1 and 3 a.m. And that's when the most impact of detoxification occurs. So I have a lot of patients who say, oh, I often wake up at 2 a.m. or 3 a.m. and I can't go back to sleep. What happens in that stage is actually they have a high toxic load in the body. And what the liver sends a signal to the brain to say, actually, I need more energy to be able to detoxify. So it releases cortisol. If it releases too much cortisol, you wake up, because cortisol is the wake-up hormone. So often when, there's a lot of clues that you can get from people. And so if your liver doesn't detoxify you well, and it's not able to dump all of this stuff and get it through your elimination pathways, then what happens is you're functioning today on yesterday's waste. That's how you need to think about it.
Okay.
So sleep has a profound impact on your body as a whole, but also on your brain health, because then the brain detoxifies after the liver. So it's really that sweet spot between 3 and 5 a.m., right? Where you really go in, that's very restorative sleep. And your lymphatic system, which is the detox part of the blood circulatory system, 60% is active at night. Your lymphatic system, which is the brain's detox pathways, they're active at night. So when you don't sleep, you don't cleanse. And as a result, you're basically every day, you're carrying garbage and you're walking with it, and you're wondering why you feel like crap. And that's the reason.
Yeah. Listening to your explanation, it's so interesting. And I'm just thinking about my own life. I'm like, oh, that's probably why I'm waking up at like 3 a.m. Okay, now it makes sense. now I understand. But what I like about functional medicine, and what I wanted to ask you about, is you said at the beginning it's making people aware of their ailments. What is they come, like you said, with the presenting problem, but there's a lot behind it that is probably playing into that problem, and that might not necessarily be the core issue. So you've been working in the field for a couple of years now and seeing patients. So what is the biggest, I guess, lessons that you've learned now from your patients working in the last few years, and how has it given you a different perspective on functional medicine and medicine in general?
Yeah. I think that I think one of the biggest things I've learned is that the body is incredibly resilient. The human body is just so resilient. And there's so much wisdom in it, and we just don't appreciate it because we kind of take all of that for granted, and we also give a lot of our power in terms of our own wellness and well-being to others, right? To the physician, or or the therapist, or whatever, so on. But actually we have so much power in our hands to change the trajectory of our lifestyle or of our health, but that we're just not aware of it. And I realized as I practice more and more, you start to notice patterns of behavior, you start to notice patterns of physical appearance. And I try to now really hone in on my physical examination skills, which is always a challenge over virtual, but we're trying to get creative with it. But your body actually is sending you signals constantly, but we're just not tuned to it. It's done so effectively in Chinese medicine, but we don't do it here. And I think that lost art of physical exam is it's a real shame, because you can tell so much by just looking at a person. For example, if your nails, they grow on average every 6 months, so you have basically a 6-month record of what your body is going through. So if, for example, your nails are brittle or flaky or they break, then you know that there are vitamin and mineral deficiencies in the body, that there's some nutritional deficiencies going on in the body. If the half moon that's at the base, that white half moon that's at the base of your fingernails, if that's missing, that's a sign of protein insufficiency or deficiency. Either you're not eating enough, or you're actually not digesting your protein very well. There's a reduction in your digestive enzymes. If you have white spots, for example, on your nails, that's normally a sign of zinc deficiency. If you have ridging on the nails, longitudinal ridging, that's a sign of low stomach acid. So there's so much you can learn from the human body without even having to probe and test, So I love these things, like, for example, your tongue can tell so much, and your oral health can tell us a lot about what's going on in your body. So, for example, if you have a white coating on your tongue, that means you have a dysbiosis, an imbalance in your gut flora that's contributing probably to indigestions and health issues. If you have bleeding in your gums, that's a sign of inflammation, and also imbalance in gut flora. It needs to be corrected. If your tongue is scalloped, so it's not smooth on the edges and it kind of goes in and out, kind of like with the pattern of your teeth, that means it's an enlarged tongue, and there's a stagnation in the blood, and the liver is a little bit overloaded in terms of toxins. It's also a sign of potentially low B vitamins and zinc. There's just so much of these. If you have, for example, a crack, I see so many cracked tongues. It's scary. Cracks in the tongues is a sign of is an early sign of autoimmunity. There's overactivation of the immune system at the gut lining, because it depends on, of course, the shape, because if it's in the middle versus if it's sideways. But I see like those deep grooved tongues, and people are saying, I don't feel well, and I feel sick, or I have bloating, constipation, so on and so forth. Because 70 to 80% of your immune system lives behind the gut lining. And so if there's a breach in that gut lining, or there's inflammation in that gut lining, the immune system is overactive, and that translates on your tongue. So there's just so much you can learn. Chicken skin, that people commonly call it, which is keratosis pilaris, on the back of your arms, that's a sign of vitamin A deficiency and fatty acid deficiency. So there's so much you can learn from the human body. And that's what I learned, that I often don't have the luxury to test people with all these amazing functional medicine tests that are a lot more comprehensive and granular than conventional medicine tests. And I just don't, either because they're abroad or the cost is prohibitive. But just looking at the body and understanding it that way, and listening to their story and making those adjustments, it's enough to make a huge shift in their health without having to use all the other fancy things in addition.
Yeah. Like you said, everything that you're saying just resonates with the name of that book, is that the body does keep the score. And like you said, you can learn so much just by just looking at a patient that can tell you so many things. But I can't believe how small the details are. That's what's blowing my mind. I'm like, I'm looking at my nails now. I'm like, do I have anything? I have no idea. One of the things that I've been thinking about during our conversation today is that functional medicine, I love the vision behind it, and I like how it looks at all these three different areas. But I can also imagine sometimes it can be quite maybe overwhelming for a patient because there are a lot of these are a lot of significant changes that you need to make. First, starting with the mental aspect, and then like from a lifestyle perspective. So, how do you define, or from your perspective, that you've been able to treat a patient? Because I think you can get them over the presenting issue that they came with, but functional medicine seems more like a complete shift of lifestyle, and that's something that would have to, I guess, continue to go on for the treatment that they've come to you for to actually take effect and last. So how do you see or define, when a patient has made that transition and is on, in a different place?
Yeah. So I think the difference, here's where I think another really critical difference lies between sort of functional medicine versus conventional, is that all the decisions we make are in partnership with the patient. Because to be honest, most of the work is being done by the patient, not me. I'm just giving you guidance and direction, but the heavy lifting is being done, which is kind of a reversal of the equation. The 80-20 rule. The 80 is really now with the patient, not the practitioner. So it's kind of a negotiation. I normally lay out the entire plan and I say, okay, this is all the areas we need to work on. What is most feasible? What can we start with that's easiest for you to implement? And it's all about small incremental changes. Now, I have patients who were like, I'm all in or all out, right? And so they just take it on and they want to do it and they want to get better in 3 months. And they're like your high performance, normally they're working in corporate or on their own businesses, or athletes, right? Or some people are just completely fed up and they just can no longer, they've reached a point where their health is in such a bad state that they're willing to do anything. But then there's people, they're like, actually, no, this is way too overwhelming for me. I'm going to start by only cutting out coffee this week. And then next week, and it doesn't matter as long as we do it at a pace that's comfortable for you, because every change, it adds up and it makes a massive difference at the end. So that's how I work. It's a partnership. So I think that probably the biggest effect comes from sleep, fixing your sleep and cleaning up your diet. You can do so much by just these two.
Yeah.
As a first step.
Please, no, go ahead. Sorry.
No, I was going to say the part around the mental health or emotional health, that's always a sensitive topic. Of course, you recommend, my always go-to is always breathing techniques. That's easy to do, doesn't take time, is not, doesn't overburden the patient, because, meditation is not everyone's cup of tea. But if I have patients with major traumas, then I refer them. I work with trauma specialists and I work with extensive coaches and nutritionists. And I just refer patients when I feel that they need that extra support.
No, sure. I think that makes perfect sense, because sometimes, like you said, there are certain issues that need to be addressed, especially from a mental perspective and trauma and so on, in the right way, or someone who's very focused in that field. But one thing you've spoken about today a couple of times, and this is something that I think about often, because you can read so many things that tell you this is how to boost it, which coming to the immune system. Everyone has, if you go online, there's 10 million ways that people say to like that can boost your immune system. And, all these supplements and all these kinds of things. So, and I don't know. I genuinely don't know what to believe or not to believe. So speaking to someone who knows exactly what's going on, how do we start to build our immune system and how do we maintain it? What are the most important factors that we have to think about when looking at our immune system?
Great question. Very timely as well, given the panic that we're in. I do usually run monthly talks with a dear friend and a functional nutritionist. Her name is Farah Helou. She's actually based in Abu Dhabi. And we do those talks, they're free. And our next topic is going to be about building immune resiliency in children, because a lot of parents are now worried about sending their kids back with, the COVID scare. So I'll share that with you when that's available. You can share it with your team, because whatever we do for kids is the same we do for adults. It's just the dosing varies. But when it comes to immunity, the important thing is we're not trying to boost it. we're trying to regulate it, because what you want is a regulated immune system, not an immune system that's underactive or overactive, because an overactive immune system is going to overreact when an infection happens, and what actually leads to a lot of the negative symptomology of COVID, where we heard about the cytokine storm, right? Where the body overreacts and then starts to attack the tissue, and then we have these problems. And then we don't want it to be underactive, where it's completely oblivious to the fact that there's an infection going on. So people, for example, who tell me, oh, I haven't gotten sick in 10 years, that's not a good thing, right? That means that your immune system is probably sleeping, and we need to wake it up a little bit,
Oh,
right?
that's interesting.
So,
Okay.
yeah. So because people you kind of wear it as a badge of honor. I've never gotten sick. And then I measure them, and one of the important markers of immunity, like your innate immune system, the surveillance, which is the secretory IgA, is like really low. I'm like, well, your surveillance is down. It's not working, So how are the troops going to come if there's an infection, right? The surveillance will call on the troops, which is the second arm of the immune system. So with the immune system, you need to make sure that it's regulated. And the way you make sure it's regulated is a lot of the things we talked about today. One is you need to have an anti-inflammatory diet. So no sugar, and no processed foods, no fried foods. You want to eat as much as possible a whole food diet. If you pick up something and there's more than 3 things in the label, then that's not a whole food, that's processed. Avoid it. You want to eat something that's grown out of the ground, and not something that's been man-made, right? So stick to whole foods, and lots of dark green leafy vegetables that has a lot of the vitamins and minerals that the body needs, that the immune system needs. Now, the immune system honestly requires all forms of vitamins and minerals, right? And fatty acids and so on. So we can't say that specifically you need to take this. I think everybody should be on a good multivitamin, given the inflammatory lifestyle or environment that we live in. But really, supplement is a supplement, right? It's something you add on top. So it's not the things that I actually go to. The things that I always go to is clean up your diet, as I mentioned, avoid sugar, anti-inflammatory, processed foods, dairy, gluten in certain types of people. But that's the key message. You want to eat a whole foods diet, and then you want to optimize your sleep. If you don't sleep, you don't regenerate. Your immune system doesn't get to rebuild. So sleep is really critical. And you want restorative sleep, not just, oh, I slept 10 hours, but I still feel tired. Well, that means you didn't get restorative sleep. So look at sleep hygiene. It's so important. You want to be able to be off screens at least an hour before going to bed. You want to be asleep before 11 p.m. And if you need to work, because I know people are now digital, and if you need to work, excuse me, then buy blue light blockers and work away. At least they block the blue light and promote the release of melatonin, so that when you're done, you're ready to go to sleep. Meditate before you go to bed. Recenter yourself so that you're more in that parasympathetic state. And I also work on your stress. If you're constantly wired and living in a state of fear and anxiety, that's going to dampen your immune system. As I mentioned earlier, high levels of cortisol correlate with worsening COVID-19 symptoms. So you definitely don't want to have that stress. So I encourage, definitely don't watch TV early in the morning, the news in particular, and don't watch it at night. Don't watch anything in the evening that's going to raise your cortisol, like horror movies or, heart-wrenching documentaries. You want to keep things light in order to put your body in a state of parasympathetic rest, digest, and restoration state. So really looking after your emotional well-being is so critical in this time. And spending time in nature. Wherever you can, if you're able to go out in nature every day, 30 minutes, that's going to have a profound impact on your heart rate variability. It really brings you back into that balance between the sympathetic and the parasympathetic. So just 30 minutes in nature does wonders for your body. And then the most critical in terms of vitamins is vitamin D. That's really essential for your immune system. Most people are either deficient or insufficient. And I would encourage everybody to test their vitamin D and take vitamin D. It's so easy to test, and you really want to have optimal vitamin D levels. And to be honest, I have not seen all the patients I've seen, have not had a single patient who has optimal vitamin D. Most people are on vitamin D supplementation. I think if you're going to supplement with anything, it should be vitamin D.
Okay. That's on the vitamin D point, which I think is hilarious. That here growing up, I don't know how many times I've spoken to friends and they've had a vitamin D deficiency when we live in a place that is like sun 24 every year, all day, and yet people are still deficient. But it's interesting also that you said that you might not be at the optimum level that you should be. So I think that's also an interesting point. But as a person, all the things that you mentioned are fantastic, and how to boost your immune system, and as you said, sorry, to regulate it and to make sure it's performing in the best way. But let's say I'm a person now, Khaled, sitting here right now. How would I be able, without, I guess, going for some type of, I guess, medical test, how would I know where I'm at? What would give me a good indication of how is my immune system?
It's a good question. I think that, so with the immune system, it's quite really hard to measure, because the only way we know how to measure an immune system is by measuring the white blood cells. But, white blood cells is just number of army, soldiers you have in your army, which is not, it's such a rudimentary way to measure it, because the immune system is so much more complex. So we measure it indirectly. I think that if you have any of those signs of inflammation, you know that your immune system is not functioning well, i.e., if you have brain fog, if you have headaches, if you have experiences of nausea, if you have disrupted sleep or inability to sleep, right? If you feel anxiety or a feeling of heart racing, if you feel really cold, or you are profusely sweat, or if you have any gut symptoms, because as I mentioned, the gut is the gateway to the immune system. So if you have constant like sinus issues, inflammation, if you have bleeding gums, is always a sign of inflammation going on. You need to fix that. But if you have constipation, if you have diarrhea, if you have bloating, that is all a sign that there's a dysregulation in your immune system. So if you have any of those signs, then you need to work on improving your overall well-being.
Okay.
And with the immune system, it's the gut. You need to look at the gut, and you need to look at your adrenals. If your adrenals are not balanced, and if your gut is not in good shape, then your immune system is always open for dysregulation.
Okay. So looking out for, those smaller symptoms, or the things that seem to be occurring with us more consistently, would give us a good indication of where we're at based on, those factors that you mentioned. Okay. That's really interesting. I got to start to pay a bit more attention, especially the sleep one.
But you can measure your vitamin D, because I think you can order it now, and it's just a prick test. It's a finger prick test, and you can get your vitamin D measured, and then as soon as you get the result, just start supplementing.
Oh, okay. I had no idea that you could do that. It was something that simple. I think it might be a good idea to get it checked out, just in case. We focused a lot on the scientific aspect today, and the chemical aspect and all the things surrounding functional medicine. But you also recently, over the last, I think, year or two, correct me if I'm wrong, decided to also become a health coach and get that qualification. So what was the motivation for becoming a health coach, and what did that change for you in and how you work now? What was the difference between just being a functional practitioner and also now being a health coach? Is it same thing? Do they complement each other, or walk us through that?
They definitely complement each other, because as a practitioner, it's very easy to get roped into the role of diagnosis and sort of treatment and prescription. And I think that there's something very humbling about understanding someone's psychology and behavior from a coaching perspective, because that gives you a much better handle in terms of how to optimize the treatment plan so that you are setting them up for success. Because the treatment plan that we put people on is not your run-of-the-mill treatment plan. Here's your prescription, go fill it out in pharmacy, and I'll see you in a couple of months. it's not really, it's a major, it's disruptive. It's disruptive to their lifestyle. And so you need to be able to motivate them so that they can adopt it. And I see it often, the case is where people come to me and say, yeah, I've been to this other practitioner or this other practitioner, and they just give me all these things, and to be honest, they're overwhelming. My lifestyle I travel all the time. And if we don't take the time to tailor, it's all about personalized medicine. So if we don't tailor the treatment to match a person's life as it currently is, then it's very difficult for us to gain any traction or move them towards healing. So that's why I wanted to do the coaching degree, because I see how powerful coaching is in my life. I've had a life coach for many years now, and it's been a tremendous support. And I think that with patients, sometimes they need a friend, not a practitioner. So I think that, or sometimes they need a coach. And so you need to be able to switch those hats while you're there and be able to read your patient a bit better. So that's why I did it. And I think I really would encourage any physician and any healthcare professional, it doesn't matter what they're practicing, that they do some form of coaching training, because whatever we're going to do now for the future is going to require behavioral change. And if you don't have that skill, it's going to be a struggle to get your patients to come with you on that journey.
Yeah, I think that's such a good point, that coaching, whether it's health coach, life coach, whatever type of coaching that you need to do, it just gives you a whole new perspective on probably the issues that you've been working with for a while. And now you can understand how better, like you said, because it's like you correctly said, it's very easy to give you everything that you need to do and just let you go. But if I can't motivate you to start making those changes and create a personalized plan, like you said, then it's just not going to work in the long term. You won't be. I don't think the patient will not be able to make the changes that they need to make without having that perspective. Working in the healthcare industry, you mentioned that your one of your roles was to bridge the gap between innovation and how that's going to play into how it's going to affect patients. So when I was because I worked in the medical industry for a year, but in sales. So we used to sell a clinical trial platform to organizations to help them, run their clinical trials. So I learned a little bit about, the healthcare industry. I'm not an expert at all in any way, shape, or form, but that point was very interesting because there was things that were coming up about decentralized trials and making trials a lot more patient-centric, which I think was why personalized medicine is coming into the play a bit more. So why is it so important to bridge that gap? And what's what's missing? What's the missing piece when, people are thinking of, oh, let's make this drug or this, form of medicine, and not taking into account the patient side of it?
I think that there's probably a few missing pieces in that bridge. I think that at the moment, from my personal experience, because I was so passionate about integrating the patient into into sort of the drug development journey, and as well as the education side of things. But I think that the industry is quite heavily regulated, and it's becoming more and more regulated. So I feel for them, because there's sometimes their hands are tied in the things that they are able and not able to do. There's a lot of restrictions from regulatory bodies, from governments. And a lot of it boils down to the fact that it's the cost element of the huge investments they've made to bring this drug to market, and the cost associated by the government to pay for this medication to allow access for the patients. Ultimately, it boils down to that cost aspect, which is very frustrating. But again, it's just the way the things are set up. And I think one of the reasons is that pharma companies sink so much money into clinical trial designs, because clinical trial designs have been this way for so many years and they haven't changed. And I think it's time that we move on, because they often don't reflect the true reality. Because when you do randomized controlled trials, you're testing in an environment that doesn't really reflect the reality of the situation. You're monitoring these patients, you're looking at them regularly, you're controlling all aspects of their life. But in a real world setting, that won't be the case. So that's why there's a massive rise of real world evidence studies and registries, because we're trying to actually assess what is the true impact of the medication when given in a real life setting versus in a controlled setting. And we always see a drop actually in the efficacy. It's not as high as I would expected it in the real in the trials, which is expected, of course, because there you're controlling, there you're not controlling. You don't have aspect, and that's where the person's story, life story, becomes so important. Their circumstances, and I think that for us to be able to bridge the gap better in terms of getting innovation to the market is really having the patient more center stage and really involved in that process of design and delivery, because ultimately they're the customer. I mean, for many years, the customer was the physician, but really it's not the physician. And things are changing now because the pharma industry model is not the same as it used to be. So really your end goal is the patient, but the patient is not really, they're taking into consideration way further down the line, because ultimately what's looked at is the disease. And again, we have to move away from disease-centered model to patient-centered model. That's the problem. If we keep thinking about a disease-centered model, our ability to get more medications to the market is going to be more and more difficult, because even the way economists or payers look at things is from a perspective of numbers. If I give this medication to X number of people for this disease, what's the return on investment in terms of the outcomes they get, right? But we kind of stripped out the empathy and the full patient story, and it's not just a numbers game. So that's what I feel, that if we don't do that, we're going to continuously miss the opportunity, because there's so many people who need this life-saving medication and they don't have access to it.
Yeah, I think something you mentioned that is so true, which was especially with pharma trials and so on, which is the cost. Because I learned working in the industry how like hundreds of millions of investment and the years it takes to just get to like run a phase like 3 trial, and like you correctly said, the efficacy tends to drop because phase 2, okay, it's more controlled, but when you get to phase 3 and you're testing a much larger population, there's so many things that you're not from the patients that you're not taking into consideration, which is why the efficacy drops up. And like you said, their hands are tied. Like the medical field is just about regulation. There's more regulation and standards I had to learn about that I can even remember. But yeah, so it kind of, like you said, it hinders the innovation because it might work, but I guess it has to be just redesigned from the beginning, just focusing on the patient, like you said, rather than the disease, because you're missing out on all the other variables that would give you a much better chance for that trial or that drug to be successful and useful, I guess, in the real world.
Yeah, I was a massive advocate when I was working with the industry to do design programs that are beyond the pill programs, right? Yeah, okay, fine, you design this drug to treat, but there's a lot more you can do to make sure your drug is more effective by making sure that the host that you're giving the drug to has a much more optimal state of health, right? Because if your immune system is not functioning, you're metabolically dysfunctional, and so on, and then you take the medication, its effect is not going to be as great. So that's why it's not just about the pill. There's no silver bullet, especially when it comes to chronic diseases. And that's why you see so many failed drugs, or drugs with really marginal benefit. There's way more side effects than there are benefits, because we're not treating the root cause. We're again just focused on, okay, what's the disease? Here's the drug, and off you go.
Yeah, like you said, I think like we spoke about at the beginning, moving from a transactional approach to a more holistic approach, and from preventative treatment to instead of curing. I think it just boils down to that at the end of the day.
Yeah, absolutely.
Yeah. Dr. Amal, I wanted to first of all say thank you so much for your time today. I have loved this conversation and I've learned so much. I'm going to have to rewatch this just to like make some notes and like, okay, this is what I need to change. I need to do this, but I'm sure it's fine. And thank you for bringing and explaining to me what functional medicine is and bringing more awareness to it, because it was the first time I'd ever heard of it and what it does. And I just love the approach and how it takes into account so many different areas of your life, because I think I'm not a doctor, but from what I'm seeing and from things people I've spoken to, having a more holistic approach is so crucial in order to have, I guess, long-term success for everyone in general. For my last question of the day, this is something that I ask all my guests. what is the message that you'd like people to take home with them today?
Well, thank you so much. It's been such a pleasure. I'm so happy to be here to talk to your audience. Thank you so much for inviting me. I think that the key message I would say to people is don't accept the first thing that you are told in any healthcare setting. Please dig deeper. Please ask why. Don't just take, and it doesn't matter, even if you go to a functional medicine practitioner, any physician, ask them for the reasons. Ask why this is happening to me. Can you give me an explanation? If they're not able to give you an explanation on the spot, at least they should be able to try or direct you to somebody else. This is your health. Don't just give the power to somebody else just because they have the degrees and the labels and the title and the experience. Because ultimately, nobody knows your body better than you. And our goal as an effective practitioner's goal is to get you more in tune with your body, and give you answers, open your eyes to where the things that you're doing are not benefiting you and what you can do to benefit you, and obviously support you as you need from a medical intervention. But ultimately, we don't want to see you in our office again. Ultimately, we want you to be healthy. We're not in the business to repeat business, right? I want my patients to be healthy. Yes, you can come for a fine tuning every now and then, but ultimately that's what we want. And so my big advice is do your research, do your homework, ask the questions, and don't be afraid to challenge your physician. That is their job. You should challenge them in order to get you to the answers, because when you don't have answers, that's what's most frustrating. That's what most people come to. They're like, I don't know why. And really, just by knowing the reason, they relax. They're like, okay, it's fine. I know why this is happening. Now I can take my time to fix it. So that's what I encourage everyone to do, is just keep asking why and don't be afraid to inquire.
Yeah, I think that's amazing advice, and definitely something that I haven't done in the past. I usually be, whatever the doctor says, okay, they know, that's what it is. But I think you made a very good point that finding the reasons is always super important and helps the patient and both understand why is this happening and what do I need to do to fix it. But also what you said is taking control of your health and you have the power to influence your health. So don't just give it to the physician or to the practitioner, whoever it might be. And like you said, do the research and look for a second opinion. I think that's awesome advice. So thank you so much. Thank you so much for
Thank you
coming
so
on the
much.
show. I really
It's my
enjoyed the
pleasure.
conversation. This was awesome. To everyone, guys, thank you so much for listening. I really appreciate it. And as always, hope it helps. Peace.